Some of the most common reasons we see for pet visits are definitely skin problems, itchiness, or skin allergies, ear infections, and also GI problems. Pet allergies are an issue because there is no cure. They are basically managed by trying to decrease a pet's itchiness and thereby decreasing the amount of secondary infections they get because of their itchiness. There's 3 types of allergies. There's flea allergies, food allergies, and environmental allergies. Environmental allergies are usually seasonal when they first start out, but then become non-seasonal as the pet gets older. Flea allergies are year-round, and also food allergies are year-round. There are a lot of key points that differentiate the 3 types of allergies from each other, but sometimes there's a lot of overlap in the clinical signs and how they present, so it's best to take the pet to a veterinarian and have them get a good history and take a look at the dogs to see where the lesions are and also what might be causing the itching to determine what type of allergy a pet has. Every dog has different areas that they will scratch or itch at because of their allergies. Some of the most common ones are on their paws because when they come in contact with environmental allergies, they will get on their paws and then their pet paws will start to itch and they'll lick and bite them. Also, they'll get ear infections. It's another common place where allergies will manifest themselves, along with itchiness in the inner thighs, on the belly, and around the neck area, and I would say on the face. Every pet has a threshold for how much itchiness they can take before they start developing secondary infections and before it really affects their quality of life. Even if they have all different types of skin allergies, if you control some of the itchiness from 1 or 2 of the types of allergies they have, a lot of times that's enough to control their clinical signs and they may not get as many secondary infections. As a healthcare professional, to eliminate airborne as well as surface contamination, we recommend controlling the humidity, temperature, and ventilation of an area, as well as using surface disinfectants and also PetAirapy products. We first started treating Tasha for allergies in June of 2004. She had itchy, watery eyes, she was sneezing, she had a lot of eye discharge, and she also had very itchy skin. Sometimes her eyes would be so itchy that she'd end up scratching her eyes, giving her corneal ulcers secondary to her itching. She was in 4 times, at least 4 times a year, every year. She was on various medications to help relieve her itchiness. She was treated for dry eye with topical eye medications, including topical steroids, antibiotics. She was placed on 2 different types of antihistamines, oral and injectable steroids for her skin, and we also tried topical shampoos and conditioners. Long-term side effects of steroid use can definitely have side effects on organs within the body and can cause secondary diseases because of the steroids. They can also cause a pet to be hungrier, and so they can gain weight. They can also become diabetic, just to name a few. They come in to visit us, probably bad allergies, about 2 to 3 times a year, so about $600 to $900. In August of 2008, Tasha presented for her yearly vaccine appointment and annual exam, and her owners brought up to me that her allergies had definitely come under control, and they introduced me to a product that they had developed called PetAirapy. She looks great today. She no longer has any eye discharge, no redness around the eyes. She hasn't been here for an ear infection or a skin infection since November of 2007. So she's doing great.